I'm Dr. Zack Mills, and this is our second in our series of videos that we're doing on dental disease. What I want to talk to you today is about the treatment of dental disease when we already have the calculi and tartar that's built up on the teeth. It's important for you to know that what we need to do and how we need to do it is we're going to need to place the dog down under anesthesia to properly clean the teeth. Remember, I talked to you in our last video about how the tartar not only builds up on the outside of the teeth, but it also builds up underneath the gum line. Here you can see what we have to do is we have to dig up underneath that gum line and make sure we get all that tartar out from underneath there. Another thing that's important for you to remember is while we have them down under anesthesia, we treat these animals just kind of like they're our own pets. We monitor them with an EKG. We monitor their oxygen level of their blood. We monitor their blood pressure. We also have them on a gas anesthetic with oxygen. So again, it's just like you and I being down under general anesthetic. Here we have what we're using, the ultrasound cleaner, to get the tartar off the teeth. Initially what we want to do is we want to knock the hard tartar off the teeth around the top. Once we do that, once we get that hard tartar off the outside, then what we have to do is get up underneath the gum line and work out and get all that tartar that's trapped up underneath the gum line and all that bacteria that's on the gum line. This is the painful part. This is the part that we have to have the anesthesia for. Here you see the technician after they've used the curette, they're now using the ultrasonic cleaner to kind of flush it out a little bit more. Smooth it out down there to keep it, to get all that bacteria and all that junk out from underneath the tooth. Once we've cleaned the tooth and gotten all the garbage out from underneath the gum line, then the next step is to check to see how deep the pockets are around the teeth. This lets you know how healthy the teeth are and how healthy the gum line is. Using the probe to check the pockets, notice now as we push down here that we have a very deep pocket that goes around that tooth. You can also tell that the tooth is very mobile. It's starting to move a little bit. This is a tooth that is a typical, it's an incisor tooth, one of the teeth that are in the front. This being so loose with so deep pockets around it, this is a tooth that we're going to have to remove. Another thing we have to do with the probe is to check for furcation, where we have the roots, where the gums have receded so far back and the roots are exposed that we've got a hole that's there that goes all the way through. You can see with this hole that that probe is able to go all the way through. With that recession of the gum and that root being exposed, more than likely this is another tooth that's going to have to be removed because we've let the disease progress too far. Another step in the process of cleaning the teeth, a lot of times what we have to do is do dental radiographs. The reason why we do the dental radiographs is you can have a tooth that looks perfectly normal, but when you take the radiograph, you can see that you may have an abscess that's forming. Here, this is the root that's coming down. This space, this black space, is an area where it's just an abscess that's formed. This tooth is going to have to come out. If you don't remove this tooth, it's causing extreme pain. Along with that, it can eventually get larger and you may have the abscess open up onto the side of the mouth even. Here's another example of a root abscess. Again, looking from the mouth itself, if we looked at this tooth, it probably looks fairly normal. The dog is probably painful when you touch it. There's probably a lot of inflammation along the gum. But as I take that x-ray, I can see that the bone here has lysed, and I've got all this black area in through here. That is all basically pus that's around that tooth. You can imagine how painful that can be. It's very important sometimes that when we do the cleaning process, a lot of the times, if we find some pockets that we're worried about, we will take dental x-rays to see if there's something we need to remove. We've used our probe and we've used dental x-rays and we find that we have to remove a tooth. Here we're seeing removing a premolar tooth in a dog where we're using the extractor to slowly go beside the tooth, break the ligaments that hold the tooth down, and we're able to then, once we break those ligaments down, extract the tooth. It's important for you to know that with this tooth, you have a tooth that's this long, but you probably have a root that's going down to right about here. Here we're looking at a tooth where we've got a broken tooth. Notice the pink area right in through there. That's a nerve that's exposed. Because of the pain associated with this tooth needs to be removed. In this process, what we're going to do is use a scalpel, cut up along the gum line, use this as what's called a periosteal elevator that will allow us to remove the gum from there. Once we remove the gum, what we'll then do is take a drill, and with the drill we're going to remove the bone from the side of the root. This tooth, there's two roots that are going up and through there, so we'll take the root, move it here, remove the bone from there, and then we take another drill bit and we'll take it and we'll cut the tooth in half. This allows us then to take that periosteal elevator, to work it up in there, to break down the ligament that holds the tooth in place to remove that tooth. You know, it's a very difficult process, and again, this is why you have to have general anesthetic to be able to accomplish this. We've cleaned the tooth, we've taken any of the bad teeth out. Our next process is to try to help keep the tartar and stuff from building back up, and that's the process of polishing the tooth, which smooths the tooth out a little bit. This makes it so it's less apt for you to get the calculi building up on the tooth. Once you've polished the tooth, just like they do with you and I, after we polish it, a lot of times then we'll do a fluoride treatment. The fluoride treatment's for two things. Number one, it helps with desensitizing the tooth, making so the tooth is going to be potentially less painful, and again, does help strengthen the enamel on the tooth too. Well, we've talked now about cleaning the teeth, removing the tartar from the teeth, and getting those teeth out that are bad. Our next video is, in my opinion, the most important video. It's all about preventing this in the first place. Thank you, and we look forward to seeing you at Tiger Tails next time you're in.